Welcome to N-Powerment Nursing. I'm Linda and this is Ashley, and today we're talking about why you should trust N-Powerment Nursing, and for the first time ever we're going to walk you through our complete study package.
Before we get started, and as usual, we invite you to visit our website if you happen to be coming across us on your Facebook page and you don't really know who we are or where we come from. You can view lots of great information on our website, which is www.n-powermentnursing.com. You can join our Facebook page, which is N-Powerment nclex-rn Test Prep. We regularly publish blog posts, Facebook Live videos, as well as interactive test questions on our Facebook page. So we invite you to join us there. As well, you can like and share this video and subscribe to our live feed, which means you'll get notified anytime we do a live video, which is usually on a weekly basis. We talk about lots of important registration issues that we come up with nursing graduates, so we invite you to do that as well. We're very excited about today because for the first time, we're going to walk you through our textbook.
Ashley and I created N-Powerment Nursing because we wanted to answer some questions that graduates had dilemmas related to. And one of those questions was they didn't know where to start. The other one was they didn't know what they needed to know in order to pass the registration exam. Our program has helped thousands of graduates pass the exam. We ship all over North America. In Canada, we help PNs, practical nurses, pass their CPNRE. We help RN graduates pass their nclex-rn. In the US, we help RNs pass the nclex-rn, and the PNs pass the nclex-pn. We also help international students overseas who are trying to come to our country to work as nurses. We help ESL students, so English as a second language graduates who have struggled to pass. We help first-time test takers, and we also help graduates who have attempted the test many times. We are nursing educators. This is what Ashley and I do every day. We teach nursing theory, nursing content, and we make the connections in terms of applying that content to help students grow in their knowledge. Every day we strive to do our best. We are passionate about what we do. We believe that we are mentors and guides to our students, and we are excited about the role that we play in helping them meet their goal and becoming incredibly compassionate healthcare professionals.
We have like the best job.
We do.
So we're trying to answer this question, right? Like, if you're coming across us on your Facebook page and you've never been taught by Linda or myself and you don't know who we are, why is it you should trust us? So we thought, well, maybe we need to give you like an insider's look into why it is that every single person that's ever taken our program has absolutely loved it and said that they wish they'd have found it sooner and they would recommend it to their best friend and so on and so forth. And I think it really comes down to the fact that we know exactly what it is you need to know. There's no more guessing on kind of where do you begin with all these textbooks and all these binders, right? We really wanted to be a solution that takes all of the guessing, all of the stressing, all of the wondering out of everything and just handing it to you already done to kind of alleviate that, and your only job is to study. So that's what this textbook has done. Now I'm going to walk you through the NCLEX version of the textbook. The CPNRE or PN version of the textbook is basically the same with the exception of one chapter and a little bit different application. It looks like this. So when I'm showing this to you, keeping that in mind, so I'm actually going to walk you through the entirety of the textbook without stopping on every page, obviously, because it is a 300-page textbook. So when you take the web-based live review, this ships to your door. So you receive the hard copy, not an online version of the book. So I'm going to try and kind of fandangle and hold it up in a way that'll make it make sense. So here's the table of contents. And what's so amazing about this textbook is that it's literally every system in the body, and it revisits all of the most tested disease processes on the NCLEX, on the CPNRE, on the nclex-pn. And it does it from a safety perspective. So as an example, in a textbook, you have an overwhelming amount of information. We've really narrowed it down to what's must know, what's need to know, what's mostly tested, and we teach it in the way that it's applied to your registration exam, which typically is from a safety perspective. So from the nursing perspective, what it is absolutely important that you understand, that you know how to intervene, how to guarantee your patient's safety. So let's talk about what's in this textbook. First, we're going to tell you about your registration exam and the things that you need to know about it. And then we're going to start off with body balance. Body balance within this chapter of the textbook, I'll just spin it around. Body balance, what it walks you through is things like acid-base balance, fluid and electrolyte balance, hormonal fluid regulation, hyperkalemia, hypokalemia, stuff like this. So all of the balance of our internal body, which is really key to understanding safety, especially when it comes to fluid resuscitation in your patient, which we also talk about. So I'm not going to stop, obviously, on every page or you'd be here for 3 hours. But there's shock. Here's our fluid replacement charts. Then there's a very special place at the back of every chapter, which I'll draw your attention to here. What's amazing about the back of the chapter of every textbook, or every chapter of our textbook, is that a lot of graduates make the mistake of purchasing a test bank and using that as their only form of studying. That is the absolute worst decision you can make. And that is because if you're not studying content and you're just running questions, if you're not taking anything away from those questions that you can apply to any question, you're basically wasting your time, because of course nobody has access to the questions in the registration exam. So what we've done is also done that work for you, and that we've run thousands of test questions and we've compiled all of the never changing concepts, such as when it comes to and based it on each system in terms of how we've organized it, such as prioritization. If a patient's oxygen saturation goes below a certain level, what should you do first? Should you put on the oxygen or should you sit them up? Or if this happens, should you do something as the nurse or should you phone the physician first? So we've taken all of the guesswork out of that and we've given you the right answer in all of those situations and given you the rationale as to why that is, to help you answer those tough questions. So from body balance, we get into the endocrine system. In the endocrine system, of course, we're talking about diabetes, Addison's disease, Graves' disease, stuff such as this. Not my favorite system. Cardiac's my favorite system. Anyone who's taken our program knows that. Cardiac's definitely my thing. Diabetic ketoacidosis, a lot of safety involved there. Section 3 is the respiratory system. This is a pretty lengthy system. As you can see how many pages there are in the respiratory system. It continues on to chest tubes and goes through all of the safety application and troubleshooting with chest tubes, which is a lot, obviously. Then we have my favorite system, which is the cardiac system. We talk about rhythm strips. We talk about where to auscultate heart sounds, congestive heart failure, arterial venous problems, pulmonary embolism, stuff like this, different cardiac procedures. Then we get into everybody's favorite, dysrhythmias and arrhythmias. We teach you all of the arrhythmias and how to intervene with those arrhythmias. Section 5 is the renal system. So we're going to go through lab values, kidney stones, dialysis, stuff like that. Then we have the gastrointestinal system. My least favorite system. Not that my opinion matters. But you can see this is a very lengthy system. We're talking about stuff like pancreatitis, appendicitis, TPN, and how the nurse intervenes with that. The next chapter is the neurological system. So there's the Glasgow Coma Scale, every nursing student's favorite thing to memorize. Meningitis, intracranial pressure. There's some really important ominous signs that you need to be aware of and the safety around those. Different fractures. Let's see what our next system is. I'm not going to go through every page, obviously. Musculoskeletal system, so osteoarthritis, traction, teaching a patient to walk with assistive devices. There's a lot of safety around that. That unfortunately requires memorization. Then we're into pediatrics and stages of development, pediatric specific diseases, cleft lip and palate, stuff like that, pediatric GI problems. Peds is a long chapter. This is Linda's specialty now, maternal newborn. She's an expert in this. This is a pretty lengthy chapter, as you can see. maternal newborn is something I feel like a lot of NCLEX graduates struggle with because they took it in second year. So bringing that back into memory, a lot of safety around that. Psychiatric section. So you might think, oh, that's not really a body system. Very important to review psychiatric nursing. Management and delegation. A lot of questions on the NCLEX around management and delegation and what's appropriate and what is not. Section 13 is different diagnostic procedures. So written from a very safety specific perspective in terms of different diagnostics. As you can see, isn't this exciting? All the things you need to know. Section 14 is important one pages. We do a lot of side-by-sides here to help your study process. And then we're getting into prioritization, dietary restrictions. And then there's a section about pharmacology. Then we're walking you through answering test questions, etc. So as you can see, we've covered all the bases, but this isn't it.
We also have daily review cards, cue cards. You might wonder, why has Empowerment Nursing included cue cards? We're really the only program that combines content with cue cards. Well, we believe that you need to study for a month to 5 weeks. And of course, that might be a bit longer depending on your experience or how long you've been out of school. And so there's a certain amount of memorization that's required. And if you start studying week 1, how are you going to remember cue cards if you haven't daily reviewed them all through the 5 weeks of study? So this is why we call these daily review cards. Half of these cards pretty much is a pharmacology review. Then we have lab values. We have gone through, again, the cardiac intervals. I don't know if you can see them here. Very, very awesomely put in cue card form. And then other items that you're going to need to know. What are normal vital signs? We talk about fontanelle closures, APGAR, lochia, stages of development, the immunization schedule, which is very focused on the registration exam, and so on. And so these are daily review cards that we, is part of our complete package that we recommend that you look at every day, so that by the end of your study process, you know them cold. And we recommend also that you, as you get to know them, you let a day go by and you let some slight forgetting occur, so that when you go look at them again, it takes a lot more effort for your brain to remember that content. Because when your brain works hard like that, it deepens the long-term retention of the content you've memorized. So this is how we recommend that you use this daily review package in the form of over 300 cue cards.
So you might think, wow, that's an incredible value. We have like a nearly 300-page textbook and nearly 300 cue cards, but that's not the only thing that comes with our package. As I said, we really, really had the goal of being everything that you would need to succeed and taking any of the guessing out of it. So this is what will arrive shipped to your door when you order our web-based live review. But then, on top of all of this, and what we think is probably the best part about it altogether, is that you get 90 days access to the video web library. So what this is 90-day access to the teaching of this entire textbook. We teach every chapter within our textbook. And so what you do is you receive your textbook, you'll open up whatever chapter you want to study. You can study it in any order you want to study it. So say you decide to start with body balance, you'll open up your textbook to the body balance chapter, and then you'll go on the web-based library and you'll open the video on body balance, and you will watch us teach this entire chapter of the textbook. Now, you have unlimited access to this for 90 days. You can pause it, you can rewind it, you can watch it 150 times. You can repeat specific portions of it, fast forward it, however it is, whatever meets your needs. This being said, we're not sitting at a table reading it to you like acid-base balance is da-da-da-da-da-da. Not like that whatsoever. We are standing up, we are drawing on the chalkboard, we are making pictures, we're using props. We use things like party blowers, balloons, Barbie dolls, different water solutions, Our specialty really is making super complex, very difficult to understand things super simple. We have so many light bulb moments. We get messages all the time from students that say, I never really understood acid base, and now I understand it for the first time ever after 4 years of nursing. I really didn't understand, and now I finally get it. And because we teach the whole body, it's very unique in that we can connect things together. So in the 5th chapter of the textbook, we will say, remember in chapter 2 when we talked about this relates to this system as well in this way. And so we put all of those pieces to the puzzle together that you really don't get all of the time, because of course you're taught in different classes, and we're able to bring all of that together for you. So yeah, the video library as well, super, we have nothing but amazing feedback on it. That's not it. Still not it.
We understand that half of the challenge in passing your registration exam is being emotionally ready. And so part of our complete package is to address that, to talk about that, and to give some solutions to that and ways of coping with your emotions. We are supportive. We are caring. When you reach out to us, we are the ones that respond. If you need a phone call, we are the ones that call you. This is part of who we are. This is part of why we began Empowerment Nursing, not only to answer the dilemma that graduates were having, but also because we care about your success. Going to college or university, getting in there, completing everything, and then not having the opportunity to pass the exam, that is not okay. That is not right. So we are here and we care, and we don't want you to ever give up.
And we won't let you give up. We will search you out one way or another. So if you're still hesitant, if you're still thinking, oh, that looks great, but I'm really not sure how it works, you still have questions, you can go to our website and take our free trial, which is no cost, no obligation, and you can print out the cardiac chapter of this textbook, and you can receive limited access, meaning limited to time, but you will get access to the entire web library for the cardiac chapters. So if nothing else, go there to master the cardiac system before you attempt your registration exam. And for a limited time, we do have a coupon code right now called NPOWER50. That's NPOWER 50 for $50 off of our program that expires Tuesday. So we do invite you to visit our website and download our free trial and just experience for yourself what it is that everybody is talking about. We are so thrilled to say that we have 100% satisfaction, and every single person has said they would highly recommend our program to their best friend. So stop stressing, stop guessing, and it sounds corny, but get empowered.
Get empowered.
Corny's good.
I think so.
I think so.